Hi, class. We are entering week 3 of clinical psychology. This week, we are going to be advancing our understanding of what happens during an initial clinical interview and what other ways do we gain better assessment and clarity on the clinical presentation and what might be going on for the patient, either cognitively or psychologically. And so there are different types of assessments that we use as mental health providers in our work to gain a better gauge of what's happening and what might be best next steps in regards to treatment for the patient, depending on the population and setting. So we'll be looking at intelligence and intelligence testing or IQ tests, and learning the differences between those and other types of cognitive or neuropsychological assessments. There are many different forms actually of cognitive assessments and or memory tests, and many times neuropsychologists do a combination or battery of certain tests to answer particular referral questions. And again, different tests also vary depending on age of the population, and we'll be learning a bit about that too. And then in contrast, how do those assessments differ from personality assessments? What are we better trying to gather in those situations diagnostically, and how does that differ from the neuropsychological assessments? And what are the specific tests or populations that might use them? So it's a really nuanced way of learning the material this week. So that so your discussion post firstly is looking more at intelligence. What does that mean? How do we define that? How do you define that? How do we in clinical practice feel more confident that we have somewhat of an idea of how someone might perform across different areas or domains, and what are the tests we use to do that for intelligence? And then for your assignments, you do have the one assignment that's comparing neuropsychological assessments with personality assessments. And we want you to come up with at least 3 to 5 from each of those two categories to go into more depth with describing and talking about the different populations or conditions that this might be suited for. And of course, we're also learning about many different forms of educational tests that psychologists might use, such as achievement or adaptive or behavioral. And you can add a little of that in this assignment as well if you'd like, but we do cover that in the reading too. And then for your third assignment, this is really an opportunity to apply a lot of information that you've learned from last week and this week to 3 clinical case scenarios, 3 cases. So we first ask you to kind of read those, soak them in, but try to really understand their culture, their background, their life circumstances and symptoms that they're coming in with, and take a stab at answering those questions for all 3 of the case examples. And what's most urgent, what's most important or pertinent that's popping out at you initially? Are there any safety or risk concerns, for example, that you might want to take note of or act on more initially? And then where are you with your early case formulation on this patient? And is there more data you might want to gather? And if so, what might be an appropriate assessment for that particular person and presentation? I hope you have fun with this, and it's a real way to pretend we are conducting a first appointment or 2 with a new patient, and with 3 different patients, and being able to apply our clinical interview skills, our understanding of assessments and how and why they might be used for differing presentations, and apply them to these cases. And if you have any questions at all about the work, please let me know. As usual, your original discussion post again is due by Thursday night at midnight, and comments in response to your fellow students by Saturday night at midnight. And then your other 2 assignments are due by Saturday night at midnight. Weeks 1 and week 6, reminder, no late work can be submitted for credit. That's government and BPATH policy, really. And for weeks 2 through 5, of course, if something comes up and you need to be a day or 2 late, I can accept that. There will be points reduced though for lateness, late submissions, because this is such a fast-paced course, and you're given the material way in advance to start working on things in advance if you can. But please let me know if you need to be late the weeks 2 through 5, and I will certainly try to work with you. But if you can give me a heads up, that would be helpful. And again, if don't forget weeks 1 and 6, there cannot be any late work submitted for credit. And I'm so impressed. Many of you are really following APA formatting very well and incorporating really relevant empirical research studies to your work to support your claims and what you're doing. Please keep up the good work with this. It's and on one of your assignments this week in particular, per the instructions, we really want you to have at least one source for each of your presentations for the 3 clinical cases. And so most of your work, we are looking for you to incorporate research, but please don't forget that. I know with some of the case presentations or case conceptualizations of patients, it might be something easy to forget because you're using the scenario primarily, but in deriving your initial impressions clinically, what else are you looking at in literature to help support your claims and help you feel confident in your early suspicions about what's going on diagnostically. Hope you have fun with this work this week. Again, don't hesitate to email if there's any questions. I'll always be here for help, and I will submit a video next week as well. Thank you. Bye-bye.